Hey guys, we're going to talk about rehab and restorative care. This is one chapter in your book. A lot of this is stuff that we've already talked about, so this is kind of review at this point. Remember, this is something that OBRA requires. We have to promote independence as much as possible for all of our residents and everyone that we're taking care of in these facilities, in these long-term care facilities. We already talked about, when we talked about admission, that this would start as soon as the person is admitted. Okay, and maybe could continue after discharge too. Disability affects the person, affects everything about the person, right? We think about holistic care, everything is affected, not just physically. I mean, physically, obviously, suddenly becoming disabled is going to affect you, but it's also going to affect you emotionally. So let's take somebody who's had a stroke, for example. If they've been working full-time, taking care of themselves their whole life, now suddenly they've had a stroke and they can't move one side of their body. So yes, physically, that changes things. But emotionally, that's going to affect you. Socially, you can't get out and socialize and be with your friends or your family the way that you were before. And economically, a lot of people may lose their jobs because of a sudden disability like this. So this affects the entire person. And you guys really need to start thinking holistically. This is not just a physical thing, it's everything about this person. So when we talk about rehabilitation, we're trying to attain something. We have a goal that we're trying to reach. So we need to make sure that we have real goals for this person. If somebody's just had a stroke, for example, they might not be able to run a marathon, but maybe we can reach a goal of walking 50 feet with a walker. That would be an example of a goal. We would sit down with that person and create these goals together. Remember Maslow's hierarchy of needs. That top tier, the only way that they're going to reach that is if they are continuing to set goals and then trying to meet them. I mean, you guys have a goal right now. You're trying to get into nursing school. You're trying to become nurses. That's your goal. If somebody's had a stroke, maybe their goal is just to brush their teeth independently again. That's a goal. So we need to be working towards that goal. So with every goal, there's a time period. Maybe within 6 weeks, you're going to be walking up these stairs, for example. And a lot of time it requires a lot of hard work. So this is not just working with physical therapy. It's working with occupational therapy. It's working with the CNA. It's working with the nurse. We've got a team approach to reach this goal. Restorative care is ongoing. So somebody might be in long-term care forever. They're never going to be discharged. But that does not mean that we're not working with them anymore to try to get them to their highest possible level of functioning. So again, setting some goals and trying to reach those goals. There might be periods where people aren't able to do that, but we're always constantly working with them. And a lot of restorative care has to do with prevention, preventing contractures. We're doing range of motion to prevent contractures. We're putting those slings on, those splints on, so that they don't become contracted. Remember, always our goal is to promote independence as much as possible. So I just mentioned range of motion. That's part of restorative care. Self-care training. When you guys go to these facilities, if you have a chance, go down to physical therapy and occupational therapy and see what they have. For example, at Laughlin, they have like a little kitchen area set up, so people might learn how to make themselves a sandwich, or just basic life things to try to get them to that highest level of functioning as possible. We talked about bowel and bladder retraining when we talked about elimination, turning and repositioning to prevent pressure ulcers. Trying to reach that highest level of functioning and trying to prevent things from getting worse. That's our responsibility. You'll find that some people have special devices. This guy at the top here has a positioning device, so he's able to help pull himself out of bed. There's a plate there that has a lip around it so they can scoop food up themselves. That might be enough to make it possible for them to feed themselves. We have prosthetics that people can wear if they've lost a limb. Special devices to open cans. I mean, think about different things that you might use. Shoehorns are great for someone who can't bend all the way down and put a shoe on. We have lots of really cool devices that we can use to help people. So again, purposes of restorative care, prevent complications and maintain that highest level of functioning. Give people purpose, If people don't have goals, they don't have purpose. So think about what would happen to you if you suddenly lost your ability to walk. What would you go through emotionally, not just physically? People would lose their self-esteem, right? They become depressed, become less interested in activities, less interested in socializing. And you guys will see that when you go to clinical. People are often depressed. They don't want to come out of their room. They don't want to get involved in activities, but we really need to encourage them to do that. Because if they're just staying in their room and they're not doing anything, they lose that motivation. So as soon as the person gets admitted to these facilities, a plan is put in place, and that person is part of the plan. They're part of planning that care. So we start that treatment on day 1. And it focuses on every body system. It focuses on every part of that person. Holistic care. I think we've talked about this a few times already, where different complications from inactivity. Every body system is affected by inactivity. So if you think about your musculoskeletal systems, your muscles, they atrophy, your joints become contracted, your bones become more porous. So there's different ways that we can prevent that. Obviously, range of motion prevents, and splints, they prevent contractures. We keep that body in proper alignment so that person doesn't become contracted. Weight-bearing exercises are really great for your bones, help prevent osteoporosis. We talked a lot about pressure ulcers in here, so you should know all about positioning and why that's important to prevent pressure ulcers, especially when someone isn't moving at all. And think about the proper nutrition. What do we need nutrition-wise to prevent pressure ulcers or to heal pressure ulcers? We need proteins. We need to make sure that that person's not dehydrated either, because that's going to affect their skin, make it more dry, make it more prone to breakdown. Cardiovascular system, when blood doesn't move, it clots. So that's a pretty common complication that we see, after surgery. If we're not giving somebody anticoagulants and they're not moving, they're probably going to end up with a blood clot. So we need to get people up and moving. We need to give them those TED stockings to force that circulation back up, force that venous return. Even if it's just a little bit of exercising in the bed, it's something. They should be moving. Humans are meant to move. Your respiratory system, if you're not moving, you're going to get, that fluid's going to start settling in the base of your lungs, and you're going to end up getting pneumonia. So we want to encourage coughing, deep breathing, using your incentive spirometer, maximizing that lung expansion. When you don't move, your peristalsis slows down and you end up becoming constipated. Indigestion, sometimes your bowels just stop altogether, and that's not a good thing. So moving around, sometimes, encouraging fluids to make sure that their stool's not really dry, and that can increase risk for constipation too. Your urinary system, you could end up with a UTI, you stripped of motivation, you become incontinent. So we're pushing fluids on people, making sure they get enough. And privacy is important, If you have somebody who's alert and oriented, you want to give them privacy when they're using the bathroom, because sometimes they might not be able to go in front of you, or they might not want to. I think I would have a hard time going to the bathroom if somebody was watching me. So think about how you would feel in that situation. So psychosocially, I think we've kind of talked about this too at this point. Sitting in a dark room all day, it's not good for you. We're humans and we need stimulation. So get them out of that room, even if it's just for something small. We know what activities of daily living are. They're all the things that we are assisting with, that CNAs assist with, when people can't do it for themselves. All little things that you do throughout the day to take care of yourself and your body. So some of the reasons why people might need rehab or restorative care, we've talked about these too. MS, arthritis, Parkinson's, Alzheimer's, these all affect your body, how you move. Stroke is the #1 cause of disability in the U.S., so you're going to be seeing lots of that. Visual impairment, that makes it really hard to take care of yourself, especially if you're elderly. Think about macular degeneration and cataracts, those things that affect your vision. Deconditioning. So if somebody, for example, has been sick for a long time and been hospitalized or had a fracture and they're just very weak, then they're going to need a lot of work to get themselves back to where they were. Same with lack of endurance. Depression really changes everything too. If you don't have motivation to do things, it's very hard to do it. If you've ever been depressed before, you really just don't feel like doing anything. And it's hard to motivate that person to do something. So here's some different areas of rehab. Of course, we always think of physical therapy first, but that's not the only thing we should be thinking of. Let's say if somebody was in a car accident and they became paraplegic, they don't just need physical therapy, they need emotional therapy too, because they're going to be dealing with a lot of the aftermath of that, the depression, loss of motivation. So we need to keep that person motivated. Give them realistic goals that they can attain. Occupational therapy is to help that person become functional. This is how to dress yourself. This is how you can cook again. Just basic life skills. Speech therapy is more than just speaking. If we have somebody who's aphasic because of a stroke, then yes, they might need speech therapy to talk, but also to swallow. If you have somebody with Parkinson's or a stroke that's paralyzed, they need help swallowing again. So that's a big part of what speech therapy does. Cardiac rehab is to get you conditioned again, especially if somebody's had an MI. You need to maximize what is left of that heart muscle. Brain injury, there's some facilities that are just geared toward individuals with brain injuries, like Peachtree, for example, is an assisted living facility for people with traumatic brain injuries. Spinal cord injuries, they're going to have to learn how to do everything differently than they did before, so they're going to need a lot of rehab and encouragement. And stroke, we've talked about stroke. So that is a very short chapter in your book, and like I said, it's becoming redundant at this point because we've talked about so many of these things already. But again, if you have questions, please let me know, and make sure to read the chapter and to do your workbook. Thanks.